Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles to improve health and promote fertility. I'm your host, Dr. Monica Minjeur, and I'm so glad you're listening today. On today's episode, we're going to talk all about ultrasounds and how we use them as a diagnostic tool to figure out more about what's going on with your menstrual cycle, as well as any fertility-related concerns that you may be having. So let's start off today with a story about a client of mine who we'll call Julia. Now, Julia came to see me after she had an emergency room visit for pelvic pain. While she was there, she had a pelvic ultrasound done and was told that she had cysts on her ovaries. Since she was also overweight and they found these cysts on her ovaries, they gave her a diagnosis of PCOS, or polycystic ovary syndrome. Now, as a 24-year-old who had no problems with her menstrual cycles, and she certainly wasn't trying to get pregnant at the time, Julia still did get quite concerned about this. A quick social media and internet search for PCOS left her terrified of what this new diagnosis meant for her. The ER doctor recommended that she go talk with her regular family doctor about getting put on birth control pills to help resolve the cysts so they wouldn't come back again. Now, she didn't want to do this since the pain she had was just a one-time episode, so she came to see me for a second opinion. We started off with talking about what her ultrasound findings actually meant, and although the ultrasound findings were one piece of the picture for a diagnosis of PCOS, Julia actually did not end up with a diagnosis of PCOS. We were able to determine this because all of her other labs, her ovulation markers, and fertility awareness charting findings were completely normal. Julia and I also talked about how we could utilize her charting in the future to further analyze pelvic pain if it returned, and to determine the underlying causes of that pain. Finally, we discussed the cyclical nature of cysts on your ovaries at different times of your cycle, and how this can be completely normal at different points in time. So let's start off with one of the most common questions I get asked, which is, why do I need to have a transvaginal ultrasound? Can't they just put that ultrasound scanner thingy on my abdomen and take a look at what they need to find? And really the answer I give is that the closer we can get to the particular anatomy when we are doing an ultrasound, the more accurate it is. So a lot of this depends upon how much additional tissue, fat, and skin you have between where the ultrasound wand is scanning and your uterus and ovaries. This is why the gold standard for getting a pelvic ultrasound is going to be that transvaginal approach, because we can see the anatomy so much more clearly and with much greater detail. Now, the one exception to this is that if you are a young woman who has not yet been sexually active, we will always do the ultrasound scan across your abdomen instead of the transvaginal approach. One very important thing that always should be taken into consideration when getting an ultrasound is the timing of when during your cycle you are having the study completed. Now, depending upon what we're looking for helps to determine when the appropriate time is to have that ultrasound done. And where you're at in your cycle helps determine things that may or may not be normal. So, for example, if we're looking at the lining of your uterus, which is called the endometrium, we know that it should be a certain thickness at different times of your cycle to determine if that's normal or not. The other big thing that changes with your cycle is the specific evaluation of your ovaries. So if we're just looking for something like a painful ovarian cyst, or to check and see if your ovaries meet criteria for polycystic ovarian morphology, the timing of the ultrasound is not as specific, as we can generally see those cysts at any time in your cycle. However, if we are wanting to follow a developing follicle as it gets ready to release an egg, and then to make sure that follicle has ruptured, it's incredibly important to identify where you're at in your ovulation phase. Checking the ultrasound to monitor follicular development necessitates fairly precise timing as you track that growing follicle and assess for rupture and release of the egg. This is why charting your ovulation is so important as we monitor for the release of the egg. So let's talk about some of the different reasons why I would order an ultrasound. And we'll start off with talking about evaluation of heavy or unusual bleeding. Now, whether this happens around the time of your menstrual cycle or if you're bleeding during other times of your cycle, an ultrasound can be incredibly important. One of the main things we need to evaluate is the thickness of that uterine wall lining or the endometrium, as well as looking for any anatomic reasons that could be causing that bleeding. Now, if your estrogen levels are too high, your uterus can become more thickened, and so having an actual measurement can be helpful for identification of a problem. However, there are many other anatomic things that can cause unusual bleeding, like endometrial polyps, which are typically benign growths of tissue on the intrauterine lining. Fibroids are another type of typically non-cancerous mass that can grow either on the inner part of the lining or they can grow into the wall of the uterus itself and cause problems with excessive bleeding. And really, the only way to figure out these anatomic causes for the unusual bleeding is by completing an ultrasound. We also are always wanting to rule out any cancerous or precancerous reasons for unusual bleeding with an ultrasound, especially if you are approaching menopause or if you have not had a period in over a year. Another reason to check an ultrasound would be to evaluate for pelvic pain. Now remember, there are many different structures located in the pelvis that aren't necessarily the female reproductive organs. However, when we're looking for pelvic pain, especially pain that may be cyclical in nature, we want to pay close attention to any cysts that may be present on the ovaries, as well as any other abnormal findings. Now, one of the most important things that I want you to learn from this episode is that cysts or follicles are a completely normal part of your ovulation cycle. Follicles will develop as your body is preparing to release an egg that cycle. So just because you are told that you have a cyst on your ovary, this may be a totally normal thing, depending upon the timing and size of that cyst as it enlarges and prepares to release an egg. However, if you have significant pain along with an enlarged ovarian cyst, this is sometimes from an unruptured follicle. And what that means is that as that follicle is developing around an egg, it gets larger in order to support the egg after release. However, sometimes the body doesn't get the trigger from appropriate hormone levels in order to release that egg. In these cases, the follicle or cyst will just keep growing bigger and bigger and bigger on the ovary itself, which can become very painful, even if it's only 3 to 4 centimeters in diameter. We can definitely see these cysts definitively on ultrasound to know quickly that it's likely the cause of the pain rather than something more serious, like a blood flow problem or other anatomic cause. Interestingly enough, one of the best ways to treat a painful ovarian cyst is to give a high dose of progesterone, because that will often trigger that follicle to rupture, release the egg, and the pain generally resolves in less than 24 hours. Now, when people hear about a cyst rupturing, they think that's the painful part. But typically the pain experienced is actually the cyst itself that's growing and trying to expand within the pelvis in a small area. Since we're talking about cysts on the ovaries, let's talk a little bit more about polycystic ovarian syndrome and how we utilize ultrasound as one part of the diagnostic process for evaluation. Now, I want to stress that for a diagnosis of PCOS, you must have at least 2 out of 3 criteria in order to be diagnosed with PCOS beyond the teenage years. And one of these possible findings can be ultrasound criteria of polycystic ovarian morphology. Now, there are 2 different ultrasound findings that need to be met in order to fulfill that part of the diagnostic requirement for polycystic ovaries. The first relates to the size of the ovaries themselves, and they must have a volume of greater than 20 milliliters. And so it's really important that when you're getting an ultrasound, that they are calculating ovarian volume as the actual total size of each ovary. The second piece of criteria that we look at to have a diagnosis of PCOS on ultrasound findings is that you need to have multiple follicles or those developing cysts that are less than 1 centimeter in size. Now, depending upon the categorization data that you look at, some sources will say you need to have at least 12 follicles, and others will say you need to have at least 20 follicles. So I don't get so caught up on whether it's 12 or 20, but we take all these pieces into account when we make that diagnosis of PCOS. And again, I'm not looking at just the ultrasound findings. For example, if I see a woman that has 14 follicles, but no other criteria for PCOS, then she doesn't have PCOS, because we need to be looking at each piece of the diagnosis as a part of a much bigger picture for this woman's overall health. The other 2 out of 3 criteria that can be diagnostic of PCOS are going to be elevated androgen levels and signs of anovulation. So androgens, again, are going to include testosterone and androstenedione. And we can look at just clinical signs of elevated androgens, or we can evaluate actual elevated lab levels. I personally always like to check an actual lab level to be sure we know what's going on and have a number to confirm our clinical suspicion. The final criteria that we evaluate is if your cycles show that you're not ovulating or your periods aren't happening consistently on a monthly basis. And so again, you need to have 2 out of the 3 criteria. So first one would be ultrasound findings, second is elevated androgen levels, and the third is signs of anovulation. And so if you are one of the many women out there who has had an ultrasound done and you were told based on the ultrasound alone that you have PCOS, I would really encourage you that this is not enough for a complete diagnosis. Ultrasound is certainly one of the pieces that we can look at, but it is not the only piece that plays a role with diagnosing PCOS. Just as an anecdote, I recently diagnosed a woman with PCOS who had completely normal ultrasound findings, but she had abnormal androgen levels, she had abnormal ovulation, and she had other criteria that showed that PCOS was the correct diagnosis. So ultrasound is not the only thing that we're looking at for that PCOS diagnosis. The final general category of when I order an ultrasound is to evaluate when women are having troubles with getting pregnant. Now, if this is the case, we're looking for a couple of different things. One is that we're looking for normal anatomy of the uterus, but we're also checking your ovaries to determine your follicle development within a particular cycle. So let's start with talking about the shape of your uterus, and that normally is going to be looks like an upside-down pear shape. But sometimes we'll see what's called an arcuate uterus, which means that it looks a little bit heart-shaped or dented in at the top. Sometimes women can have a septum, which is a line of tissue that divides the uterus into 2 separate halves. Every once in a while, we find what's called a bicornuate uterus, which means that rather than having one regular-sized uterus, you actually have 2 separate, smaller uterine cavities that are there, which is something that happens from the time you were developing as a fetus in your own mother's womb. All of these pieces are really important to know, but they don't necessarily always mean that you can't get pregnant. However, the shape of your uterus does play a role as far as knowing and understanding your chances of being able to get pregnant, as well as being able to sustain a pregnancy to full term. Depending upon the findings of your ultrasound, sometimes we do recommend a surgical evaluation for something like a uterine septum that's fairly straightforward in order to be able to correct and can really make a big difference when it comes to getting and staying pregnant. Other abnormalities to the shape of the uterus are much more challenging to correct and sometimes aren't recommended for surgery, depending upon the particular case. The other thing that we're evaluating when you're trying to get pregnant is looking at the development of the follicle throughout your entire ovulation cycle. So early on in your cycle, as you're finishing up your menstrual bleed, you have multiple follicles that start to develop that are getting ready to go and release an egg. Those follicles will grow at a rate of about 1 millimeter per day. And generally what happens is that through all of the normal hormone pathways in your body, one of those follicles will eventually become larger than the others. We call this the dominant follicle, which will release the egg inside of that follicle at the time of ovulation. When we are monitoring with ultrasound, the intent is to evaluate that growing follicle prior to ovulation. I always want to be checking how many follicles are developing, does one seem to be growing larger than the other, and how are the follicles progressing over time. Now, based on your charting signs, when you have observed either your peak day of fertile type mucus or a temperature shift or a positive LH test to be able to identify that ovulation has occurred, that signifies the day that the follicle has opened and released that egg. Our next step then is about 3 days after ovulation, we'll recheck an ultrasound again. And what we should see at that time is wherever the dominant follicle was, we should see that it's starting to shrink down again in size because it's already released the egg. The follicle is now called a corpus luteum, and its primary role is to continue to produce progesterone, which is responsible for helping to set up a placenta if fertilization occurs during that cycle. As always, timing the ultrasounds to your ovulatory cycle is so vitally important because it centers around that main event of ovulation. Now, the last thing I'd like to mention here is just a brief word about ultrasound in early pregnancy. Now, I'm a big fan of getting an early ultrasound in pregnancy for a couple of reasons. And the first is that we want to confirm the pregnancy is located in the uterus, that it's not an ectopic pregnancy located in the fallopian tube or somewhere else where it's not supposed to be. We also want to look for a good, strong heartbeat, which we can for sure see by 7 weeks, and oftentimes as early as 6 weeks, depending upon the ultrasound equipment that's used. The other thing I like to check is to determine if you have a multiple gestation pregnancy. So we know that if you're carrying twins or more, then we want to very closely monitor your progesterone and your estrogen levels throughout your entire pregnancy to make sure that the babies are getting all the nutrients they need to develop and grow well, especially throughout that first trimester, but also as the pregnancy progresses so that we can try and prevent preterm labor. I hope we've been able to give some additional clarification as to how to utilize ultrasound as a diagnostic tool and why it's important to time an ultrasound with your cycle, as well as the importance of working with somebody who understands what's normal should be for where you're at during that particular cycle. Imagine if ultrasound findings were used as a part of figuring out one piece of the puzzle when determining your diagnosis. Imagine if you worked with a healthcare team that understood the importance of timing your ultrasound with where you are in your menstrual cycles to achieve better health and promote fertility. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, to schedule a free discovery call with me and learn more about our package-based pricing for healthcare. We are currently able to see people for in-person appointments in the Cedar Rapids, Iowa area, or can arrange for a telehealth visit if you live in the state of Iowa or Illinois. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content. I sincerely appreciate your support, and I look forward to sharing more with you on our next episode of Cycle Wisdom.